First, live, local. This is Fox 12 Now.
Welcome back to Fox 12 Now. Thank you, as always, for being here with us, live streaming whatever platform you're on, whether that's our mobile app or you're on our apps for Fire TV, Roku TV, or Apple TV. Those are all great ways to watch live and after the fact, of course. And we cover a wide range of topics here on this show. I'm Greg Nibbler, and for this segment, we're talking about National Poison Prevention Week. Very important to know what we're going to be talking about and how to avoid accidental poisonings or just being aware of basic things that everybody should be thinking about when it comes to that. To talk about this subject, we have Dr. Rob Hendrickson from the Oregon Poison Center at OHSU joining us. And Doctor, thank you very much for being here to talk about this. And to start off, before we even get into Poison Prevention Week, would you mind just telling us a little bit about yourself and the Oregon Poison Center?
Sure. Yeah, my name is Rob Hendrickson. I am a physician who's trained in both emergency medicine and medical toxicology, and I'm the medical director of the Poison Center. The Poison Center is a 24-hour healthcare information and treatment resource for poison emergencies. Our call center has nurses and pharmacists who answer the phone, can help with answering, giving emergency treatment advice or answering questions for the public, for EMS agencies, even healthcare providers as well. And we also have a series of physicians like myself that are trained in emergency medicine and medical toxicology to tackle those complex questions as well.
And when we're talking about poisonings, and the types of phone calls that you get, how often is it that people are calling in with concerns about potential poisonings?
Yeah, unfortunately, potential poisonings happen pretty frequently. We handle about 40,000 cases a year, they that's over 100 calls a day. So that's a lot of cases.
That's a lot of cases. And talking about National Poison Prevention Week, I guess to start that off, what are some of the most important things that people should know and should be thinking about?
Yeah, so Poison Prevention Week is really a method for us to get the information out about the Poison Center and how to prevent poisons, because what we really want is to have no poisonings at all. And of course, we understand that mistakes happen, and there always will, and we're there to help when they do. Some of the things that we would like to, the information we'd like to get out is for people to understand that this is a phone service that anyone can use, is free to the caller. It's available 24/7, 365 days of the year. And any question or any concern at all about a potential poisoning, we welcome you to call us.
What are the most common ways that people accidentally poison themselves?
Yeah, so most of the cases are from home, and you can imagine things like cleaning products or personal care products. Sometimes children will get into things that they're not supposed to. They might eat, toothpaste from the from the bathroom, or eat your deodorant, or nibble on a plant that they're not supposed to. But we also get lots of other calls involving medications, both over the counter and prescribed pharmaceuticals. You can, some cases that we get, you can imagine someone taking their spouse's medication by accident, maybe taking their medication for a second time and not remembering that they had taken it before, or giving a child their siblings medication. So things like this happen. Sometimes mistakes happen, and if they do, we're a resource for you to call. We'll answer the phone immediately and give you treatment advice.
When it comes to that, prevention side, since this is Prevention Week, what are some of the ways that people can try to mitigate some of those issues or prevent, these things from happening?
Absolutely. The first is when these events happen, they're incredibly stressful, and the last thing you want to be doing is trying to Google what the Poison Center's phone number is. So I encourage everyone to get the phone number on your phone, so that if something like this happens, you call. The phone number is 1-800-222-1222. It's like bunch of twos with a one in the middle. And so that's the first step. The second is to think a little bit about the things that we just mentioned, cleaning products, things that children can get into. So we recommend storing those up high and out of the way. That includes everything from, as I said, cleaning products, but also medications, things like vape, nicotine or cannabis products, things like that. We recommend getting them up out of the way and out of sight of children. Locked is best. If you can get a lockbox to put all of those products in, that would be the best. And then the other thing is to recognize that some events happen when someone will bring their purse or their bag or their jacket or whatever into a house that a child is in. And so, grandparents out there, if you are carrying your medications, I encourage that if that's something that you need to do. But there are ways to try to prevent children getting into them. One, have a designated spot in your house where you can put things like that, that's up high and out of the way. And if you are carrying medications with you and you need to have them with you, they do sell these lock bags that you can put medications in that are quite effective and will prevent children from getting in them.
In the event that somebody needs to call the Oregon Poison Center, 1-800-222-1222.
You got it.
Okay, good. I'm gonna put that in my phone afterward. I admit I do not have it in there, so I'll be doing that myself. In the event that somebody does need to call the Oregon Poison Center for an emergency, what are the important things that, even as stressful as it may be, that maybe they can think of to help you all help them?
So we're going to ask you all the questions we need to ask. So I think the most important thing is just, calling. Things we might ask you to do once you're on the phone is, things like say there's a pill bottle that is spilled over and you don't know if your child got into it. We might ask when it was prescribed, how many pills are left. We may ask you to do a pill count, things like that. Same with liquids. We may ask you to pour it into another container to try to figure out how much is missing, and those types of things, but we will take you through all of those things. So my advice is if you think that there may have been a poisoning, then just call. We know the questions to ask you and we'll take care of it for you.
Nice. So as you said, so just call. If you think there's something going on, call rather than not.
Yep, absolutely, absolutely. There's a lot of things may not cause harm, but there are some things that are concerning. So even if you think, oh, this was probably fine, that's what we're here for. We're happy to walk you through it, find out exactly how much was given or taken, and figure out if that might be harmful and whether you need to do anything.
I'm going to ask this just because I know somebody somewhere out there is going to be questioning this too. This is for humans, correct? What about pets or something like that? That's not included in this?
That's correct. We are primarily a human poison center. There is an animal poison center, and if we feel free to give us a call if it's an animal, but we may not be able to answer all your questions, and we may redirect you to the animal poison center. But you can certainly call us as a starting point.
Okay. All right. Anything else that you think is important for people to know?
Yeah, I think one more thing is one of our goals is to try to keep people at home. When we ask people what would you have done if you didn't have the poison center, about a third of people say they go right to the ER. The other third say I'd wait for symptoms to start and then I'd go to the ER, and the other third say they would call their doctor. I don't know if you've called your primary doctor anytime recently, but usually you don't get a call back immediately. And so one of our goals is to try to not have people go into these extremely busy ERs. Not only is an ER visit pretty expensive, averages about $1,400 each visit. It's about 5 or 6 hours each. And if you don't have to go to the ER, that is good for everyone. It's good for you to stay out of the ER, and it's good for the ER to not have more patients because they're pretty overloaded right now. So when someone's exposed in the home, we get about 21,000 cases a year of someone exposed in their home to something, and we keep about 93% of those people at home and avoid having to get an ambulance or an ER visit and all those costs associated with it. There was a recent study that looked at every For every dollar that you invest into a poison center, you save about $17 in healthcare costs. So it's a great investment. Again, the poison center, the helpline is free to the caller, and we do our best to keep you home as best we can. And in some cases, we'll give you a call back in a couple of hours and make sure you're doing okay. And so we can do things like that as well.
All right. Well, Doctor, thank you very much for joining us, and thanks for being there for everybody at the Oregon Poison Center, 1-800-222-1222.
You got it.
Save that phone number and give a call if you're having an issue.
Great. Thank you, Greg.
Thanks a lot. And for everybody watching, this is Fox 12 Now. Again, just to remind you, we're live streaming, but you can watch all of these episodes after the fact, and this would be a really good one to share. Let other people know about it and make sure that they're staying safe as well. We're going to take a break. We're going to come back. We'll switch gears. We'll hear from the Portland Thorns. So a wide range of topics on this show today, but these are the longer form segments and conversations we get to have. So thanks for being here. We'll be on break for just a minute, so don't go anywhere. Right back with more Fox 12 Now.